Okay, I have my primary bag hanging up. Everything is primed. I'm gonna go ahead and label it with my initials and the date so that we know when to change it. Okay, and now I'm gonna program it.
Hold on, we'll start it. The rail was already down. Okay. We have to be done by what, Thursday?
Okay, I'm just gonna program it as IV fluid, normal saline. We're gonna do 125 milliliters an hour, and the total volume is 1 liter or 1,000 milliliters. I'm gonna hit OK, and then I'm gonna hit run.
Do you have any questions? I'm gonna get on my stuff and wash my hands. I'll be right back.
I'm gonna take the clamp off. Okay. It's asking if drops are flowing. They are, and nothing is kinked. And so now we have the primary infusion running. Okay. Alright, I have the doctor's orders to administer antibiotics via IV Piggy Back. I'm going to come in to the room, wash my hands, and identify my patient. Could you tell me your full name and date of birth? And do you have any allergies? Okay. I'm going to be administering an antibiotic to you, sir, through your IV line. I'm going to get all my equipment ready and set up. I have my antibiotic right here. I've checked and made sure that it's compatible with my IV fluid that's already running. I'm going to do my 3 checks and my 5 writes. Make sure I have the right medication, the right dose, the right route, the right time, and the right patient. So I'm just going to double check, make sure I have the right patient. Your name and date of birth one more time for me, sir. And you don't have any allergies, right? Okay, he doesn't. Everything checks out, and so now I'm going to get everything ready. Okay, I'm going to open this, get my hook out, and my tubing. I'm going to make sure not to contaminate the spike. And then now I'm going to spike my bag, making sure not to touch anything around, just the... Okay, that's spiked. Get all the kinks out of the hose. I'm going to make sure that it's clamped before I hang it. Okay, and now I'm going to get an alcohol swab and swab my site right here. Make sure that's cleaned off. I'm going to pull off the cap to my secondary tubing and attach it to the white side. I'm also going to label the secondary tubing with a date and my initials so that we know when we should change it. Okay, and then I'm going to pull my secondary down and back prime it. Making sure all the bubbles are out. Okay, we're going to hang this back up. And then we're going to lower the primary bag below our secondary. Okay, now that that's all done, we're going to program our secondary bag now. Okay, we're going to go to program secondary, and we're going to put in an antibiotic.
Good morning, my name is Carlos.
We're going to run it at 150 milliliters per hour, and we're going to run 300 milliliters total. Okay, now that's programmed. We're going to unclamp everything. We're going to hit yes to a callback at the end of the secondary. Okay, make sure everything's unclamped and running okay. And now we're going to hit run. Okay, it's asking if the drops are falling in the secondary.
Okay, when you're doing this, do you have to be primary as well? You have to run the primary first.
Okay, and they are. And now we have our secondary line. We have our secondary Piggy Back running. Okay, so then I'm going to clean up my mess, dispose of all my trash. I'm going to ask the patient how he's doing. Are you feeling okay? Any burning, tingling? Nope. Okay. I'm going to clean everything up, wash my hands, and then I'm going to document that I administered the antibiotic. I'm going to put my infusion rate down, how the patient tolerated it, and I'm all done.